So the study that I did was part of my master's thesis. I'm a genetic counselor, so it has a bit of a genetics aspect to it. Bear with me, but I hope you'll find it interesting. So the title of it is Parental Disclosure of Familial ALS Diagnosis and Mutation Status to Children, Perceptions of Young Adult Offspring. Oh, is that better? Okay, sorry. So just to kind of give some background with respect to what I will be talking about, typically, as you all know, the diagnosis is made on a clinical basis, but now that we know that some subsets of families with ALS have this genetic component, the diagnosis may start to be made on a genetics perspective. The survival at this point is about 2 to 10 years, so for a lot of the people in this study, they found this diagnosis out when they were children, and some of their parents had already passed away by the time we were talking to them. And then from a treatment perspective, we all know there isn't really a good treatment or cure out there yet at this point. So for these individuals that I was talking to, we're ultimately talking about the thing that they know they're going to die of if they do have this familial mutation. So, about 10% of ALS is familial, 90% is sporadic. So we focused on the familial group for this study. And the genes we focused on were the SOD1 gene and the C9orf72 gene. These make up about half of all the familial cases, so we felt like this was a good representation. There's no sex bias in familial ALS, and so men and women are affected equally, and the onset of familial ALS is about 10 years earlier. So for these individuals, like I've already said, many of them were younger when they found out about the diagnosis and are younger when they start to become more aware of symptom onset or become paranoid of these things. So as far as previous research is concerned, previous studies have looked into treatment and symptom management to help affected individuals and studying the views of at-risk individuals on risk perception, views on presymptomatic testing, and reproductive decision-making. But to date, no studies have been done on the disclosure process and the long-term impact it has on individuals at risk for ALS. So this means there's not currently any guidelines or recommendations to help healthcare providers help their patients through this difficult disclosure process. And the few studies that have been done on risk perception need to be updated. There's been new genetic discoveries in the past few years that kind of change things for these studies that have been done in the past. The aims of our study were to examine the attitudes and perspectives of young adults of a parent with familial ALS towards the issues of disclosure of the ALS diagnosis. So more specifically, we wanted to learn how the parents told them about the diagnosis and whether this was an overall positive or negative experience for them. We wanted to get individuals' perceptions of risk for developing ALS themselves and their decision-making regarding presymptomatic testing. And lastly, we wanted to determine the need for genetic counselors and other health care providers to assist familial ALS patients with strategies for sharing their diagnosis and mutation status. So the way we did this was we recruited patients from the Northwestern University Neurologic Diseases Registry. There were 20 families that we contacted to invite their eligible children to participate in semi-structured phone interviews. And the inclusion criteria was being between the ages of 18 and 35, having a parent diagnosed with familial ALS, and being aware of the genetic component of their parent's diagnosis, as we didn't want to be disclosing this as part of our study. So here is a summary of our participants. As you can see, 8 people agreed to be in the study. Their ages ranged from 20 to 33 years old, with the average age being 24.9 years. The average age at disclosure was 16.4 years, so this meant for some participants, many years had passed since the disclosure had actually occurred. On average, including the affected parent, participants had 4 affected relatives. So this is going to be probably a lot more than families where it's sporadic ALS, and so we looked in to see if this impacted their overall awareness because more family members were affected, but that doesn't seem to be the case because it depends on how closely those relatives are related and how the communication in the family is. For example, participants 7 and 8, who were actually sisters, had 2 great uncles who had ALS, but weren't really aware of this until just before their dad was diagnosed, so didn't really change anything for them. So participants were asked about the disclosure process, knowledge of genetics of ALS, and their views on presymptomatic testing, and 6 main themes emerged from responses to these questions, as you can see here. By the 8th interview, no new themes were used and no new codes were used, and the data was saturated. So all participants referred to their level of awareness of ALS in their family before their parent was diagnosed, but participants had 2 different approaches to the theme of disease awareness. Some participants described an overall awareness of ALS before their parent was diagnosed. They explained they noticed some of the symptoms in the affected parent and that the diagnosis wasn't a shock. So for example, participant 3, who's a 24-year-old female who found out about her father's diagnosis at age 12, said, "Well, I knew he had some muscle weakness, like he would drop his glass of orange juice because his hands were weak." So these were things that she was seeing and noticing before the diagnosis was even discussed. Whereas other participants who were not aware of ALS in their family or were just unaware that their parents were at risk described the long feeling of the diagnostic process and how when the diagnosis was made, it was a different experience to have their parent affected versus a more distantly related relative. Many of the participants in this second group experienced denial of the parent's diagnosis. But regardless of prior awareness, many participants described a paranoia of symptoms in themselves once the diagnosis had been made. All participants also discussed the communication style used in their family. However, participants' families had different approaches to how they communicated the diagnosis to their children. Some families had an open approach to communication and shared all the information they had over repeated sessions. Other families were more casual about ALS and had less structured communication. This led to the information being shared more gradually. Participant 2, who's a 28-year-old female who found out at 14 that her father had been diagnosed with ALS, said she didn't even realize that they weren't actually talking about it until she later was talking with a therapist who asked her about these things, and she realized they never actually even had any structured communication. She just always felt like it was there. So regardless of communication style, many participants sought out additional support outside of the family, so that's also an important thing that we learned from this study. Preferences about how information about the diagnosis would ideally be shared included wanting more information over less, wanting their parents to be honest and open with them, and that it was nice to hear a simple message in the beginning, knowing that they would continue to talk about this over time. Participants had different experiences with how ALS became a part of their lives after the diagnosis was disclosed. So within the theme of presence of ALS, participants discussed how the life stage at disclosure often affected the constant presence of ALS in their lives. Many participants that I spoke with still lived at home when their parent was diagnosed, and one actually put off going to college because she felt like it wasn't fair to her parents to leave them. She felt that if she was older and had already been out of the house, that would have been an easier point in her life to find this out. Some of the participants took on a caregiver role, so this was an example of that as well. The diagnosis of a parent introduced a sense of inevitable risk for many of the participants. Many of them described how the diagnosis changes everything and there was nothing they could do about it. Participant 4, who's a 33-year-old male who found out about his father's diagnosis at age 29, said, "But that's one of those moments in life where it's like, bam, everything is different. Nothing is what it was yesterday. Everything going forward is different now. You're just not going to see it the same way, and your feelings are going to change." So it was just this inevitability of everything has changed. Participants also described the inevitability of their parents' death and how it became a normal part of the disease progression for them. That was another interesting point made by many of the participants. And many participants also described the duty they felt to protect their parents. The theme of protection resulted in participants feeling a responsibility to prevent parents from knowing they were thinking about and worrying about ALS. So participant 1 is a 20-year-old male who found out about his father's diagnosis a year ago at the time of the interview and is currently enrolled in college out of state. He said, "I haven't had this particular genetics conversation with my mom yet, and I think part of that is motivated by the fact that, like I said, my mom does get emotional rather easily especially when talking about ALS and my dad. So it was more so to kind of spare her that conversation. I kind of think she would prefer to just think of us as not thinking about it. But I still do think about it, and I can kind of protect my mom against thinking about it at least a little bit." So this was not specifically a conversation he had had with his mom, but just the feeling that he got, which resonated with a lot of the participants. Participants also discussed protection in terms of how they viewed presymptomatic testing and their ability to discuss this with their family. Some didn't want their parents to feel guilty about passing on a mutation, so they opted to wait to pursue any presymptomatic testing until after that parent had passed away. So lastly, all participants discussed their views on presymptomatic testing because they were specifically asked, but the testing motivations came down to 2 main ideas. Those who were open to testing felt it would give them more control over their lives and the knowledge of their mutation status would be empowering. Participant 6 was a 28-year-old male who found out about his father's diagnosis at age 8. He had presymptomatic testing done last year, so he had the unique perspective of being the only participant who had actually completed presymptomatic testing at the time of the interview. His views were very similar to those participants who were not tested yet but were considering it. And so he talked a lot about the power and the control he felt that this information could give him and that he could give back by participating in studies and things like that. The participants who didn't want to have presymptomatic testing felt it would be too stressful and anxiety-provoking to pursue testing, so they preferred not to know their mutation status. Participants that weren't interested mentioned learning the value of life from their affected parent and that test results shouldn't dictate how you live your life. So just to talk a little bit about what all this means. From the interviews, we learned that individuals need time to process regardless of their prior knowledge, and most wanted to at least have the option of learning information. So what this means is that parents disclosing a diagnosis of familial ALS need to have flexibility with the disclosure process and be sensitive that prior knowledge doesn't mean there doesn't need to be communication. The only way they're going to know that is if we tell them. So things for us to kind of think about as far as communicating this and helping them in their disclosure process. Studies of other diseases were consistent with our findings surrounding communication styles and preferences. So in a study for Lynch syndrome, which is a hereditary cancer syndrome, parents find that disclosure of the diagnosis difficult to communicate and end up avoiding communication altogether. So it would seem that parents aren't well prepared to disclose these difficult diagnoses, and this affects overall communication, but parents don't know how to fix this problem on their own. Most people aren't don't have these skills. So this is an upsetting process for everyone involved, and there's just not enough guidance for these people for how to approach the disclosure of a diagnosis to loved ones. So additionally, preferences for open communication, need for support outside of the family, and feelings of isolation were felt by participants of other similar studies. And so that's where we all come in. There's a potential opportunity for all of us to step in and make suggestions about how to communicate a diagnosis like this. The fact that protection was brought up by a majority of participants and is felt by individuals affected by other late onset disorders could simply speak to human nature. But this tendency to protect by the offspring should be brought up to the parents diagnosed with familial ALS. By addressing the feelings of needing to protect, some of the stress felt by the offspring may be alleviated and could provide more opportunity for open communication in the family. For those who chose testing or would pursue it, oh, okay. So there you go. The next few slides are kind of just the conclusions, which are basically on the slides. It was a small study, so we can't necessarily generalize, and it was on a very specific population of this group of familial ALS. But that being said, I think a lot of these ideas can resonate in general. This is a difficult topic to discuss, and so basically taking some of these points and just bringing them up can help these people in their disclosure process. Thank you.
So we've time probably for a couple of questions. If you can raise your hand and stand up, and we'll get the mic over to you. So I've got one in the middle here. Hi. If you say your name and where you're from.
Yes, I will say my name and where I'm from. Peggy Allred, Cedars-Sinai from Los Angeles. Thank you so much. I mean, I think this information is incredibly vital for us, and certainly want to add my advocacy for genetic counselors to be a multidisciplinary team member in all our clinics. I think it's very, very important, and you guys play such a vital role. I think part of what we've discovered in our conversations with folks is that term familial, they'll say, but nobody else in my family had it. I can't have familial. And it's really trying to change the vernacular to say, can we talk about it being genetically mediated ALS or non-genetically mediated ALS, to kind of help them understand and frame that a little bit better. Because even if sometimes when we presented the results of the genetic testing, they say, well, that doesn't mean my children are at risk. So there really is a huge educational component to whether or not there have been other known familial members, or whether or not they may be de novo, or whether nobody else with the mutation has ever really presented. So I think we're beginning this journey, especially with the C9, of trying to explain this a little bit better and how these patients can then communicate with their family members. But again, just want to advocate for the role of the genetic counselor in the ALS clinic 100% across the board.
Thank you.
Okay, and the final one at the back.
Okay, sorry. I'm Suzanne with the North Carolina ALS Association. I feel like I've had a million questions. But on this particular topic, we're very interested in this. We are piloting a telephone support group beginning on January 25th that will be for families, people who are former caregivers, people living with ALS now, current caregivers, anyone that's interested, really. It's an open group. So I'm also wondering, when she said about the vernacular to use, about titling this group. I've had some issues in my mind about whether to call it familial or genetically based or that sort of thing. Do you have any advice?
That is kind of a tricky concept to address, just because there can still be mutations in these families that are not our familial families. So off the top of my head, I don't know, but I'd be happy to talk to you about it after the fact, and kind of if as a community we could come up with a better way to title this so that it's not confusing to people. That's
Right,
that's a
right.
great
And-
point that you both bring up.
Sure. And
Okay,
just
can
to-
we stop that? I need to move on now.
Okay,
So
sorry.
if we can thank Samantha again.